morning.
Sasikala.
Sashikala, good morning, sir.
Guten Morgen, lady.
I would like to know how to explain humanness to a layman, sir, to a common man. How to explain humanness to a common person, to a common man.
Yeah. In the humanistic psychology,
Yeah.
a single person
Hmm?
is the important thing.
Okay.
Individuum is in the center of the psychology,
Yeah.
and all what belongs to an individuum, all his needs and all what he's thinking, feeling, the behavior, that is the that is humanistic psychology is dealing with this. It is not dealing with a special connection to the society, for example.
Okay.
It is important what one person needs. So there are a few axioms.
Okay.
They belong to the humanistic psychology, and the main important, I think, is that you start to accept a person like the person is, and that you don't want to change a person if the person doesn't agree to it. So person is always the most important concentration you have. So if a client coming to you, the first is that you ask it, how are you and what do you want and what is your problem? And you don't have an idea how you can help them and how you can change the person. The person must know himself what he wants and what he wants to have better for his life.
Okay.
Yes, you can.
Yes, sir, one more question. I'm not able to see you, sir.
Yeah.
Yeah. Sir, you said you have a group and you talk to them, right?
No,
you do.
We are doing something together.
You said you will be training, or you talk to them and then how to communicate, how to understand their feelings, what they are feeling, how they feel, how they behave, and everything.
Yeah.
Suppose if I have any issues, how can I go and talk about my issues? It's not like Alcoholic Anonymous, what we have and all. I may be having a personal issue with my husband, for example.
Yeah.
So how can I go into a group therapy, sir? I mean, I can rephrase it. If I have a personal issue, if I come to you as a client, how will you take it up?
So if we are working in a psychodrama group, you have a possibility to choose a group member to be your husband. And then you can make a request and you tell this person what you think about your husband and what your opinion is about this, about your husband. And then after you make the role reversal back, this person knows something about your husband and can play the role of your husband in the way you showed it before. It is not an improvisation. The group member has to play the role in the way you showed before. And you
exactly.
Yeah?
Yeah.
So, and then we can work with it.
Okay.
And the problem here is that your husband is not really there.
Yes, exactly. That was what I was about to ask you, sir.
So, and the idea is that the problem is not your husband. The problem is inside of you. So, and you can change something in yourself by working with the problem. And then you go back home with a little change.
Okay.
And this little change your husband at home.
Okay.
Because he needs to react to your new behavior. It is small steps.
Yes.
And it takes 1 year.
Oh, okay, sir. Thank you, sir.
Bitte.
Yes, Dr. Chandra. Dr. Chandra. Yes, yes.
Yeah.
Suresh,
Yes, sir.
in connection to this last question, and we have cultural issues.
Yes.
It is very difficult in psychodrama to ask somebody if they are the same sex. Probably you can assume, and you can do the role play. But I'm not sure how if it is a mixed gender crowd, how you'll be able to do it. It is kind of I think there is a question in it. So I think it is difficult because it has got cultural issue here.
Yes.
Yes.
I think you are right.
Yes.
It is difficult, but if you pay attention to the religion and if you accept it and you are not working against it, you integrate it.
Correct.
Then it is possible
Yeah, it is.
to get new experience and new new behavior about it.
Absolutely.
Yeah.
Yes, for Dr. Gridhar, sir, you can.
Good afternoon, sir.
We have the same problem in Germany. If I come to a group and this group is very religious and I have to deal with it. They believe things perhaps I don't believe. But if they tell me what they believe, I have to accept it. And I say, yes, I can understand that you believe that. And it is possible that I believe other things. Usually I don't believe something.
Yes, Doctor.
Yeah, good afternoon, sir.
Hello?
Good afternoon, sir.
Yeah, good afternoon.
This is Giridhar.
Yeah.
Sir, this is, we can call it as a lockdown syndrome. Group of psychological issues are coming because of this lockdown now. Man is social animal, according to Aristotle. But now that statement became as a just statement only because of isolated life, less interaction with others, doubting nature, and lack of recreation and lack of spiritual visits to the temple or churches, apart from this recreation. And we are facing a lot of problems in India, say especially.
Yeah.
And restoring of the normality will take minimum 2 to 3 years time, people are telling. So how to face all these situation in society? And majority of us who are participating in this conference today are teacher educators, and we are going to develop the teachers for the society. And if we develop proper strategies and proper content to the teachers, and they will go and mold the society according to the needs. So we need to change the curriculum of the teacher education as per the new challenges now. Right now we have to change. I request yourself, what teaching content and what teaching strategies we need to develop, like cognitive constructive behavior, otherwise uh, psychological approach, otherwise what you are telling is drama, psychodrama, all these strategies, how to develop in content and give a whole solution for the entire nation, not only nation, universe. What strategies we have to develop further in case of curriculum of the teaching?
Yeah, Professor, his question is, what are the changes we should make in that curriculum?
Once again?
What are the changes we should make in the curriculum? For example, we are having different curriculum for studies, for education. To develop well-being, what changes we have to make?
What changes?
In the curriculum.
Teachers curriculum, teacher education.
I didn't get it. Which curricula?
Education, sir. In the education system, what are the things we have to make?
See, we have to tell him what is our system, no boss.
Yes, sir.
You are asking about changing something in the teaching system?
Yes.
Yes, yes.
Yes.
This is a new situation. Sir, are you able to listen?
Yeah, you can.
Yeah, this is a new situation. We became isolated and less social interaction and
Yeah.
doubting nature and lack of recreation, lack of spiritual visits to the temple and the churches where we can relieve ourselves, and a different situation we are going to enter now, already entered. In this situation, teachers' role is vital. They are going to teach the children as well as the society. So being teacher educators, what type of new curriculum developments we have to adopt? That's my question.
Mm-hmm. Yes, the problem is that I cannot understand you.
Thank you.
Professor. Hello, Professor.
Tell, sir.
No, actually, because of our speedy communication, Professor Hans sir is highly disturbed. I think so. If your question, you are going to throw your question in a slow mode, you can able to understand. Can I help you, sir? Can I try?
I
Sir,
can
I
hear
try
you,
to
but
again repeat it.
I cannot understand you because the voice is a little deformed when
Yes.
it comes to me, and you speak a special accent,
Yeah.
and that is
Professor, actually, what Giri sir is asking. Hello, Professor Hans sir. Hello, sir. Hello, Professor. Hello.
Yes, sir. Yes, sir. Yeah.
No, actually, I willing to speak with Professor Hans.
Okay, you better use tell that to him.
Yeah. Hello, sir. Hello, Professor.
yes, I can hear you, but I cannot understand you.
Yeah,
Yeah.
sir. Your
That
voice,
is my voice is not clear, sir. Sorry, sir.
yes, sir, your voice is not clear. I think better, ma'am. Can you try to translate? Yes.
Can I do it? Yeah.
Yes.
Yeah, that's nice.
Yeah.
Sir, what he is trying to ask you is, right now we are under lockdown period.
A lot of
Lockdown. We are in lockdown.
lockdown.
So we are isolated.
Yes.
no human interaction, much human interaction,
Yeah.
only online socializing, but not face-to-face physical interaction is not there, limited, very limited to
Yeah.
only family members.
Yeah.
And no going to temples, churches, or any other mode of spiritual things where we can relieve our tension, stress, etc.
Yeah.
So he is a teacher educator. The person who asked the question, Dr. Giridhar, he's a teacher educator. So he's asking what are the contents he has to change to educate the teachers right now, because the teachers are teaching the students.
I think there's no solution.
Pardon me, sir?
There is no solution for this problem.
There is no solution. Okay, okay, sir.
But we
Yeah.
can try to communicate by online conversation.
Yeah,
That is the only possibility in this situation now.
right now. Yeah. Sir, one question regarding that only. When we are communicating online, yet it is not like physical interaction.
Right.
So we are getting frustrated because I'm not able to see you and I'm
Yeah.
not able to understand clearly as it is face-to-face communication.
Yeah, that's
So we
right.
are getting stressed,
Yes.
no recreation, no going out, no
Yeah.
watching movies
Yes.
and all in outside, etc.
Yes. I think we will get a lot of psychic illness at the end.
Yeah.
A lot of disturbances. A
Yes.
lot of depression.
Yes.
A lot of aggression.
Yeah.
And so we only can hope that this virus is going back in a short time, that we find some vaccination and that we can do something against it. And that's
Yes.
the only possibility to come to a normal situation again.
Yes. Till then, how do we deal this situation? What are the strategies we can adapt or adopt, you can say? Adopt, actually.
I
Will
think,
psychodrama help us during this time?
no, not really.
Yeah, yeah. That's what maybe his question was indirectly.
No, not, of course not. Because you see, this conversation here is very difficult because I'm speaking in English. That is not my language.
Correct. Understood, sir.
And you are speaking an Indian English with a special accent.
Correct, sir.
So our communication is very difficult in this case.
Agreed, sir.
So, but if I talk to you, for example, I get a good feeling.
Oh, okay. Thank you, sir.
Yeah, there's an emotional connection between us.
Yeah.
And that is important too.
Yes. Exactly.
I think in this isolated situation, every person has a due to find out what he can do to make the situation for himself and for the people around better.
Yes.
That can be that you do something new, cooking together, for example. Or it is possible that you can go out without meeting other people. You can wear your breathe mask.
Yes.
And you can control the distance to other people. All is not good.
Correct.
But it is better than sitting alone in one room. I think in Indian there are always people around.
Yes. Yes.
Yeah. So that is a very difficult situation because the danger of infection is very, very big
Yes.
if people are coming together in one room.
Yeah. Correct.
But I think we have to deal with the situation.
Yes.
I got information about Moscow.
Ah.
They have the same situation there,
Mm.
and the government made a big organization where you can call and get psychological help.
Help. Yes.
You can talk to people, and so you mustn't feel alone.
Yes.
And that is very important, that you have something you can talk to.
We have it here also, sir. Telecounseling.
Yeah.
Yeah.
Very bad, yes.
Yeah. And one more question, sir. Shall I go ahead?
Yes.
Yeah. Good.
Sir? Sir, can I ask you one more? Somebody else's question.
Yeah.
Yeah?
Yeah.
Do you also work with children in psychodrama?
Yes, of course.
Oh.
Yeah.
You also work with children.
But you need to change the methods.
Okay.
You will find some videos about children psychodrama in YouTube.
YouTube. Oh, okay.
If you search for my name in YouTube, you will find psychodrama with children.
Okay, sir.
Good.
Thank you, sir. Thank
Yeah. Bitte. All the best for you.
Thank you, sir. Thank you very much.
Any questions, dear participants?
Yes.
Hello?
Yes, sir.
Hello.
Yeah.
Yeah. Hello. I wanted to ask, how
Yeah.
can you make someone realize their true desire and speak about it? People spend their entire life without having an aim, a proper aim.
Harish, can you ask again?
I want to know that how we can make someone realize what they really want in their life.
The first is that you ask him. The first is that you ask the person.
Yes, I did, but many people themselves don't know what they want in their life.
Yeah. Right, yes. I think it is a longer conversation. You need to be very consistent in asking. You need to find out what is really behind the not knowing.
Okay.
I think all people have inside an idea what they need. Sometimes they don't know it because they reject it or they cover it and make something different and don't want to show it. And so you must be very sensible and very intensive to talk to these people and to accompany them on the way to find out what they really want.
Okay.
Hmm?
Yeah, thank you.
Bitte. Nice to see you. I never saw you before.
We talked on Facebook. It's Harish Verma.
I know, yes. Nice
Yeah, this is the first time we are conversing on video.
Nice to meet you, yes.
Yes, nice to see you. You look very happy and very young.
Danke. So,
Yes. Anybody else?
Suresh, one more question can I ask?
Yes, sir, please go ahead.
Yeah. Dr. Werner, I have, I've been always thinking, I started after this corona problem, my usual washing has gone up. Okay. Now I know because they are also advising on the television channels and even in the telephone you get please wash your hands and for 20 minutes, 20 seconds and things like that. So my worry is, whether I'll become OCD. That has gone into my head now. So is there any way that, to have positive thinking about it, to get myself affirmed that, I won't get the OCD?
So I need help in translation.
Yeah, I said, I don't want to be a obsessive compulsive disorder. I don't want to get into because
into which disorder?
Obsessive compulsive disorder, OCD.
Yeah.
Okay, I now my washing is it is almost 4 to 5 hours.
And why do you think that you go into this disorder?
Because I'm doing it now. Every time whatever I touch, immediately I go and wash.
Yeah.
So it's a worry for me now.
That's good in this situation.
Okay.
You have fear that
So some other noise disturbance is coming, Suresh.
Yes. Do you have fear that it stays after Corona?
Then I can look at it.
Yes, that was my my suggestion. You should wait for it.
Thank you.
Don't get fear now.
Yeah.
It is too early.
Too early, yeah.
Okay. Washing the hands is really good now.
Yeah. Yes.
Yes, sir.
Thank you, Professor Werner.
No problem.
Dr. Veena, are you there? Yes, you can propose vote of thanks.
Okay.
Yes. Yeah.
Hello, sir. That was really got to know many things, and it wasn't like a regular workshop where we had the PPT slides learn. This was something unique. I just want one small question. So, can you tell us about incongruence and how to deal with that?
About what?
Incongruence. Incongruence.
Incongruence. Can you describe what it means? I don't get the word. It is incongruence or
Congruence, congruence, incongruence.
And what does it mean?
Whenever there is any disparity between the real self and ideal self in humanistic approach.
You think it is a departed personality?
When the ideal self and real self don't match.
Yes, I understand what you say, but I don't believe in this theory.
Okay, sir.
Because I think that a person is always a whole person
Okay.
and cannot be departed in different roles.
Okay.
So, but I know this, and I had patients. They told me that they have different identities, and they changed their identity. They spoke with another voice, and their behavior was different, and they had different opinions about situations, and so. But if you start to combine these different parts of the personality, to integrate them, to communicate between them, they start to become a whole person again.
Thank you so much, sir. Your presentation was very sweet and very nice. And thank you, Suresh Kumar, sir, for this wonderful opportunity. Thank you so much.
Yeah, bitte.
Professor, I think I take this opportunity to thank you for accepting my invitation and share your valuable inputs on the topic. And I think this is a new way you have taken the session. Most of them were benefited from your inputs. For that, for my sincere gratitude and thanks to you. We will meet again for another session. And dear participant, thank you for your support for the initiative taken by us. Thank you all. Thank you, sir. Thank you.
Goodbye.
Yes, goodbye.
Thank you very much.
Thank you, sir.
Bitte. Danke for translation.
Yeah.
Yes.
Auf Wiedersehen, Hausweiner.